Dear students, welcome back. Now we are going to see some of the other features of the lungs. In the previous videos, we have finished introduction about the lungs and some features of the lungs and also some of the relations related to the apex of the lung. Isn't it? Yes. Now, coming to the base of the lung, here if you can see the base here on the both sides, so the base is semilunar and concave in shape. The base is semilunar and concave in shape. Here it rests on diaphragm, so this part, the bases rest on the diaphragm, so the dome of the diaphragm will be present below this concave surface. That means on the dome the base of the lung will sit. Okay, so it rests on the diaphragm, which separate the right lung to the right lobe of the liver. Below this diaphragm we will have the liver in the abdomen, and the left lung is separated from the left lobe of the liver. Okay, and also on the left side we'll have the fundus of the stomach. So fundus of the stomach is also present on the left side of the stomach. So besides the stomach you'll have the spleen, another organ called spleen is present. So this base rests on the diaphragm, which separates the right lung from the right lobe of the liver, and whereas the left lung from the left lobe of the liver, and the fundus of the stomach and the spleen. Okay, this is about the base of the lungs. Okay, now we are going to see the borders here. So how many borders I have told? So we are having, each lung is having three borders. One is the anterior border. Okay, another one is the posterior border. We can see here the posterior border here, and another border is inferior border. So this is the inferior border. So now we will see one by one. Anterior border is very thin. Anterior border is very thin. So this is not this anterior border. Here this is anterior border is very thin here, from here to here only. This one anterior border. Okay, anterior border is thin and it is shorter than posterior border. So posterior border is longer, but the anterior border is shorter here. So both the anterior borders are shorter here. On the right side it is vertical and corresponds to the anterior line, that is the costomediastinal line of the pleural reflection. That means it follows. So on the right side it is vertical and it follows the costomediastinal line of the pleural reflection, whereas on the left lung the anterior border, if you see here, the anterior border of the left lung shows a wide cardiac notch. So this border continues as a cardiac notch. So in this space the heart is situated. The heart will sit like this in the cardiac notch. Okay, so the anterior border of the left lung shows a wide cardiac notch below the level of fourth costal cartilage. Below the level of fourth costal cartilage. The heart and pericardium are uncovered by the lung. So at this part, the lung will not cover this heart and the pericardium. Okay, but it is located inside the notch. Okay, so this is about the anterior border of the right lung and as well as the left lung. Okay, the anterior border of the right lung is vertical, and it is, both the anterior borders are very thin, and these are shorter than, these anterior borders are shorter than the posterior borders. This anterior border on the right side it is a vertical line, it is almost vertical line and corresponds to the costomediastinal line of the pleural reflection. And on the left side, the anterior border of the left lung shows a wide cardiac notch below the level of fourth costal cartilage. The heart and the pericardium are uncovered by the lung at this region. Now coming to the posterior border, this posterior border is thick and ill-defined. So we can't see any sharp borders on the posterior side, but the border is very thick and it is ill-defined. It corresponds to the medial margins of the heads of the ribs. So we know that, so in the middle we are having this vertebral column, isn't it? So each vertebral column is having an attachment with the rib, isn't it? So in the rib, so this medial margin, this posterior border corresponds to the medial margins of the heads of the ribs. So on the medial side of the heads of the rib, this posterior margins are related. So like this, here all heads are present. So at this part, the posterior margin of the lung is related posteriorly from, it extends from the level of 7th cervical spine to the 10th thoracic spine. From posterior border corresponds to the medial side of the heads of the ribs, medial margins, we can call it as medial margins of the heads of the ribs, and it extends from C7 to T10, and it extends from C7 to T10 in the case of posterior border. And coming to the inferior border, this inferior border you can see here. So this inferior border, so somewhat it also covers the mediastinal surface also. This inferior border, this is the inferior border. Okay, the inferior border separates the base, the inferior border separates the base and also from the costal and medial surfaces, from the costal and the medial surfaces. So the inferior border separates the base means inside, below this thing, so that is the concave structure. So that surface is separated from the from the costal surface and the medial surfaces. So medial surface and the costal surface are separated from the base because of the presence of this inferior border. Okay, this is about the inferior border. Now coming to the medial surface. So the medial surface here we can't see, but this medial surface, for example, if you turn this lung laterally, right lung to the lateral aspect, so it will shows like this, and it is having a root of the lung is present on the medial aspect, and this one is divided into, so the mediastinal part, so that means on this side it is having, so the mediastinal part or medial surface is divided into posterior. So I have turned this one laterally, so like this I have turned this thing, so this becomes posterior now. So on the posterior it is divided, it is called as vertebral part because it is very much nearer to the vertebral column, so it is called as vertebral part. And it is also related to the vertebral bodies and the intervertebral discs, and also the posterior intercostal vessels and splanchnic nerves. And this anterior part is called as mediastinal part. What do you call? Anterior part is called as mediastinal part, and the posterior part is called as vertebral part because it is related to the vertebral column. Okay, in the vertebral column, with the vertebral bodies and the intervening intervertebral discs. And also on the posterior aspect, it relates to the posterior intercostal vessels and the splanchnic nerves. So the mediastinal part is related to the mediastinal septum, and it shows some cardiac impressions. And the hilum, that is the root of lungs, are present on both the sides, and number of other impressions which differ on the two sides. That means, so for right side and left side, both are divided: posterior vertebral part and anterior mediastinal part, and some of the impressions are present on these on this mediastinal surface on right lung and left lung. But because of the presence of these impressions, we can identify which one is right lung and which one is left lung. So the impressions may be changed in right and left lung, that we are going to see separately in the next video. Okay, so this is about the surfaces of the lung. How many surfaces are there? um, uh, we are having three borders. One is the anterior border, posterior border, and the inferior border, and we are having costal surface and mediastinal surface. In the mediastinal surface, what are the things we have seen on the mediastinal surface? Is earlier, that is it is divided into anterior mediastinal part and posterior vertebral part. Okay, and now coming to the costal surface, the another surface is the costal surface. This costal surface is large and convex, and it is in contact with the costal pleura and overlying thoracic wall. Just visualize or imagine yourself how this costal surface, you are seeing anteriorly only this costal surface. So that means, just think, so here you are having this all structures called thoracic cage. So here you'll have the sternum, isn't it? And this sternum and all this ribs, isn't it? And behind you'll have the vertebral column. So all these ribs are getting articulated with the vertebral column. So that means the ribs are present from the anterior side to the lateral side to the posterior aspect. That means all these things, so all this area is related with the costal area, this costal area of the thoracic wall. That means the costal surface is related from anterior side to lateral side as well as the posterior side. That means it almost all related anteriorly with the thoracic wall, laterally with the thoracic wall, and the posteriorly it is also related to the thoracic wall. So it is called as the costal surface is large and as well as it is convex. So because you can see, so from anterior to posterior, how the shape is formed, convex or not? Yes, that is convex, and it is in contact with the costal pleura and the overlying thoracic wall. This is about the surfaces of the lung. So these are all the features which are seen on the lungs, or it is having an apex and base. Okay, apex is present on the upper end and base at the lower end, and this base is resting on the diaphragm, and it is having three borders: anterior border, posterior border, and the inferior border. And it is having two surfaces, one is the costal surface and the mediastinal surface. Okay, and another important feature in the lungs are the fissures and lobes of the lungs. Fissures, so you can observe some fissures. Fissure is a structure which is having a depression inside the organ, so which separates into two or more segments here. So now, what are the types of fissures are present in the right lung and left lung? Because of this fissures, the lung is divided into different lobes. So now we are going to see. So the right lung is divided into three lobes. See here, you can see this is one lobe, second lobe and third lobe. It is divided into three lobes, that is superior, middle lobe and the inferior lobe. So three lobes are present. These three lobes, how it is formed? By two fissures. So there are two separation, two types of fissures are present here. So these fissures, one is the horizontal fissure and the oblique fissure. So this one is the oblique fissure and this one is the horizontal fissure. So because of the presence of these two fissures, the lung is divided into three lobes. That is, right lung is divided into three lobes. So now we'll see the oblique fissure. So here we can see this oblique fissure. Yes, the oblique fissure cuts into the whole thickness of the lung. So if you take the lung, it will cut the lung from posterior aspect to the anterior aspect, except at the hilum. Root of the lung will not divide here. The remaining part of the lung is divided by this oblique fissure, except at the hilum. This fissure passes obliquely downwards and forwards. So this fissure passes obliquely downwards, forwards, downwards and forwards. So crossing the posterior border. So on the posterior aspect, this oblique fissure crosses the posterior border about 2.5 inches, below the apex on the posterior aspect, and the inferior border about 2 inches from the medial plane. So from the medial plane 2 inches, from the inferior border 2 inches from the medial plane, this oblique fissure we can see here. Due to the oblique plane of the fissure, the lower lobe, so this one, the lower lobe, that is the inferior lobe, is almost present on the posterior aspect. So because of this oblique fissure, the lower lobe is almost present on the posterior aspect. Okay, and the upper lobe is present more anterior. Whereas the posterior lobe present on the posterior aspect. Okay, so the same thing is present on the left side also. So on the left side also it is having an oblique fissure which divides the lung into two lobes, anterior and posterior. So in the left lung we are having only two lobes, whereas on the right lung we are having three lobes. So we have seen only oblique fissure, so it makes the lung into two parts. Where comes this third lobe? Yes, in the right lung the horizontal fissure is present. The second fissure is present in the right lung. This fissure passes from the anterior border. It passes from the anterior border up to the oblique fissure. So it starts from the anterior border and ends up to the oblique fissure and separates a wedge shaped middle lobe. So because of this, it separates another lobe which is in the form of wedge shape. This becomes the middle lobe in the right lung. Okay, so this fissure runs horizontally at the level of fourth costal cartilage and meets the oblique fissure at the mid axillary line. It meets the oblique fissure at the mid axillary line. Okay, so on the left side it is having a uh, tongue shaped projection uh, which is present below the cardiac notch. Here this is the cardiac notch and you'll have a tongue shaped projection. In this we can't see on the right side. Here we can see the tongue shaped projection called lingula is present, which corresponds to the middle lobe of the right lung. So this lingula corresponds to the middle lobe of the right lung, but it is having, on the left side it is having only two lobes, on the right side it is having three lobes. These three lobes are formed by two fissures, one is the oblique fissure and the horizontal fissure, whereas the left lung is divided into two lobes because of only the oblique fissure. A lingula part is present below the cardiac notch on the left lung, which corresponds to the middle lobe of the right lung. Okay, so this is about the other features of the lung, that is the fissures and lobes. So the number of lobes may vary in either of the lung. So sometimes the right lung will have only two lobes, in some cases only, in some cases, or sometimes extra lobes are also present. These are very exceptional cases. Okay, the lungs expand maximally in the inferior direction. So the lungs expand maximally in the inferior direction because the movements of the thoracic wall and the diaphragm are maximal towards the base of the lung. Because what is happened here, this diaphragm, on the diaphragm this lung is resting on the domes of the, whenever this diaphragm descends, what is happening, a space is created, so the lung will expand at the basal level. Okay, so the presence of the oblique fissure of each lung allows more uniform expansion of the whole lung. This presence of oblique lobe helps in the lungs, allows the lungs uniform expansion of the whole lung. It helps in uniform expansion of the whole lung. This is about the fissures and lobes of the fissures and the lobes of the right and left lungs. In the next video we are going to see the medial surface of the right lung and medial surface of the left lung, and I have told that some impressions are present on the medial side of the right lung and the medial side of the left lung, and also hilum, that is the root of the lung, which is having a pulmonary ligament. I have already explained in the lungs and pleura, just go and refer it. So we are going to see the same pulmonary ligament as well as the root of the right lung and left lung, which are related on the medial aspect of the mediastinal surface of the right lung and left lung. Now we are going to see those things in the next video. Thank you.